Dr. Frida Lewis Hall of Pfizer is here to share 3 of the top health questions to ask your dad this Father's Day. And Dr. Frida, research has shown that men can be hesitant, we know, to talk about their health, and they typically visit the doctor less than women do. Let's talk about the health consequences of that.
Yeah, well, so that's a problem because men may miss an opportunity to discover and deal with issues at early stages. And we know that for many conditions, that's the time when they're more treatable and less threatening. And we know, however, that some men choose to get their health care only in cases of emergency. In fact, there was a survey that showed that 77% of men would rather go shopping with their wives or significant others than to go to the doctor.
And why do men often avoid going to the doctor? They may be afraid of what they might find out. They dread the questions or procedures that can be part of an exam, or they may have a mindset of, I'm going to tough this out, but just going to the doctor is not enough, is it?
No, not enough. It's just the beginning. You have to go prepared. And prepared with things like the family medical history. You got to know it and share it. Because some conditions that a family member may have would put you at greater risk for having that same condition, even if you don't have any symptoms.
I want to talk right now about the importance of talking to your relatives about their health. Since it's almost Father's Day, consider starting with good old dad. So Dr. Frida, what are some questions you should ask?
Okay, so first question is, Dad, how is your heart? And if Dad says that he has a heart condition, you want the particulars, like when. When did it develop? If it developed before he was 55 years of age, that may put you at greater risk for developing it. But don't stop there, because you also want to know about the family history of risk factors for heart disease, like diabetes, high blood pressure, and high cholesterol.
Speaking of cholesterol, most men should have their cholesterol checked roughly every 5 years, starting at age 20. Doctors may check it more often if you have an increased risk of heart disease or stroke. Men, know your blood pressure. We often talk about high blood pressure being a silent killer. Know your numbers. Even if it's been historically normal, get your blood pressure checked formally, a minimum of every 2 years, if not more often. So, Dr. Frida, let's talk about another question for Dad.
Okay, second question is, Dad, is there a family history of cancers that I should know about? Some of the cancers that most affect men, like colorectal cancer, prostate cancer, melanoma, can run in families.
For example, having one or more close relatives, like a father or brother with prostate cancer, may increase your risk of developing. Make an informed decision with your healthcare provider about screenings. Believing you're at a higher risk of a disease may encourage you to be more proactive about those screenings. And Dr. Frida, we have time for one final question you should ask.
So one more question, and that is, Dad, do you have any mental health issues that we haven't talked about? Studies have found that a family history of some mental illnesses puts you at greater risk of developing them. Things like schizophrenia, bipolar disorder, and major depression.
Men with depression may be more likely to withdraw and feel irritable, aggressive, or even hostile. They may also experience common symptoms of depression, such as fatigue and apathy, changes in appetite, or loss of interest in previously enjoyed activities. Men may also feel shame or try to, as I said earlier, tough it out. But without the right treatment, depression may get worse.
It is so true. So if you have any signs of depression, talk to your doctor or to a licensed mental health professional. This is really important. And seeking the help that you need for a mental illness is a sign of strength. For more information on questions you should ask your father, and also a more complete men's health checklist, you can go to gethealthystayhealthy.com.
Thank you for that. And hey, Dad, happy Father's Day.